Welcome to everything you need to know about going to the ER. I'm Dr. Amy, and I want to clarify that I am not a medical doctor. I hold a doctorate in nursing. Today's topic is triage. Triage is a French word meaning to sort, and that's how nurses assess and prioritize who gets seen first by a doctor in the ER. The ER is not a first come, first serve environment. When you visit an ER, you will start at the registration desk. You will give your name, your birthday, and some other personal details. Then you will see the triage nurse. As the triage nurse checks your weight and your vital signs, she or he will ask you a series of questions. Let's review vital signs. If you didn't see video number 1, vital signs consist of temperature, heart rate, respiratory rate, blood pressure, oxygen saturation, and pain. So we're going to start with your main complaint. Why did you come to the ER at that particular time on that particular day? What's been going on? Tell us what hurts, when it started hurting, how bad it hurts. That's called the severity of the pain. And this we measure on a 0 to 10 scale. So when your nurse asks you, rate your pain on a 0 to 10 scale, we are asking you how severe the pain is. And I talked about this in the last video. Give us a number, 0 to 10. We also want to know what it feels like. What does the pain feel like? Is it sharp, dull, squeezing? Is it pressure? Is it burning? And does it radiate anywhere? Like, does your chest pain radiate down your left arm or up to your jaw? What makes the pain better or worse? Like when you take a deep breath, does your pain get worse or not? We're also going to ask you about your allergies. Do you have any allergies to medications or food? We're going to ask you about your medications. What medications do you take every day? Or what medications are you supposed to take every day? What medications did you take today prior to coming to the ER? Please don't not medicate yourself. If you or your child is having pain or fever, please take a dose of Tylenol or ibuprofen. We don't want you to suffer, and we will believe you if you come in without a fever, if you tell us that you had a fever. Also, please don't tell your triage nurse to look in my chart because you can't remember what medications or allergies you have. Looking up your chart would be very time consuming for the triage nurse. And as you know, time is of the essence. Here's a tip. Keep a list of your medications and allergies on your phone. The triage nurse will also ask you questions like, what's your name? Tell me where you are. Tell me the month and the year. And why are you here? These might seem like silly questions, but this is how we test your orientation and mental activity, which is a very important part of the triage. We will also ask a screening question about whether you're feeling suicidal or feeling like you want to hurt anybody else. This is just a typical screening question that we ask everybody, so it's not just you. We will also ask about your use of tobacco, alcohol, and drugs. Do you smoke? Do you vape? How much do you smoke or vape? How many years have you smoked or vaped? Also, alcohol. We want to know how much and how often, and also drug use. Again, this is a screening question that we ask everyone. So don't lie. We're not asking these questions to get you in trouble. They help us to assess your overall health. The triage nurse will use all of this information plus their clinical judgment to assign you a triage score. So here is our 5-level triage scale. Level 1, the sickest patients. They need care immediately. There's something life-threatening going on. Level 2, an emergency that could become life-threatening. Level 3, urgent, but not life-threatening. 4, semi-urgent, again, not life-threatening. And 5, non-urgent. They need treatment when time permits. So, this triage score or patient acuity score tells us how sick someone is. How sick or not sick you are determines the order in which you'll get seated in a patient room and how quickly the doctor will see you. So, the sickest people get seen first. How quickly you get seen also depends on how busy the ER is. And how busy the ER is depends on how many patients are there to be seen, the amount of staff on duty, including doctors and nurses, the amount of space available, and the amount of resources available. And I also want to mention that calling the ambulance does not automatically put you in line ahead of everyone waiting in the lobby. If it's not a true emergency, you may end up being asked to go wait in the lobby with everybody else. So please don't take an ambulance out of service unless it's a true emergency. More about EMS in a future episode. A few more things that you might consider when coming to the ER. The ER never closes. We are open 24/7. When the inpatient beds in the hospital are full, the admitted patients stay in the ER and we care for them. Social holds stay in the ER and we care for them. If we have any behavioral health holds, they stay in the ER and we care for them. So, as you can tell, this cuts down on the amount of beds and resources available to the people who walk in the front door. When you visit the ER, expect to wait. Bring a book, bring a sweater. Please have realistic expectations based on how sick you are. Lastly, know that we are doing our very best. Understand that we are normal people working under sometimes extreme circumstances. We get tired, we get grumpy. Most of us work 12-hour shifts that are hard on our bodies and sometimes hard on our souls. Please be kind to your doctors, nurses, techs, housekeepers, security guards, and registration staff. We are humans who want to care for you, and we are doing our very best. Thank you and stay well. If you have questions or comments, please join in the conversation. Like and subscribe and comment below.